Joe Carey says, AMA questions, considerations for a client returning from a mastectomy, single in this case, no reconstruction at the moment to consider, without further treatment, e.g. chemo or radiation. Or go into drug effects considerations, as I know that adds another whole layer of the effect, e.g. I have clients who are super sensitive in their hand joints, especially thumb, post-treatment. So, Joe, for clients with or surviving breast cancer, the general recommendations, according to the American College of Sports Medicine, are to return to exercise as soon as possible post-surgery, and that might be up to 8 weeks because sometimes people undergoing cancer treatment take longer to heal. Sounds like that may not be the case with this lady because she's not undergoing chemo or radiation. So basically the regular post-surgical guidelines apply. So that would be, basically medical clearance from her surgeon, but, generally around the 6-week mark. And the considerations there would be, closed wound, minimal swelling, all of that kind of stuff. But that's up to the surgeon to give clearance on when exercise is okay. And then the exercise considerations will just be, firstly, just general post-surgical rehabilitation. So she's going to have lost range of motion, strength and proprioception in that limb. And so you'll need to work on all 3 of those with her. And range of motion goes in the shoulder, goes in 6 kind of planes of motion or 6 degrees of freedom. So the arm, you can lift your arm straight up in front, that's shoulder flexion. You can reach it out behind, that's shoulder extension. So she needs to work on range of motion and strength in both those directions. Then you can lift the arm out to the side, that's abduction. You can bring it down and across the midline, that's adduction. So she needs to work on range of motion and strength in both of those directions. And then finally, you can rotate the shoulder out and you can rotate it in. So external and internal or lateral and medial rotation. And she needs to work on range of motion and strength in both of those directions as well. And so initially, once cleared by the surgeon, I would suggest start with separating the range of motion exercises and the strength exercise. So do kind of passive range of motion. She can hold like a broomstick in both arms and use her good arm to kind of push or lift the operated arm into maximum stretch position. She can do reps or she can just do a held end range for 30 seconds to 2 minutes. And I would do that probably every day if she's got the stomach for it. It should be a bit painful, it shouldn't be agonizing, but it should be fairly uncomfortable. And then separately do strength work, because her strength work will probably be in a smaller range of motion because she won't have the strength through range to combine both yet. And then as she gets back towards full range and her strength starts to increase, then you can start to combine those strengthening and mobilization exercises. So that's it's just essentially a pretty straightforward rehabilitation protocol, and rehabilitation is nothing but the process of restoring strength, restoring range of motion, and restoring proprioception or coordination. So you need to practice all of those elements. The second consideration will be that, or may be, that she may have, if she hasn't had a reconstruction yet, she may be very self-conscious of her appearance, and so you'll have to read that or negotiate that with her. She may not be, but being sensitive to that, I'm sure knowing you, I'm sure you will be. But basically, that could be things like, well, maybe not giving her a mirror to look in when she's doing it, or maybe facing her away from other clients when she's opening up her shoulder joint or whatever. And the third thing is, at least initially, may be painful for her to weight bear on it, like lie prone. But you can probably get around that by lying her on a foam roller or arc barrel or something to do any prone work that you want to do. So hope that helps. And in terms of drug effects and considerations, so, number one side effect of many cancer drugs is, or number 1 and 2 are fatigue and nausea. So those are just things that you work with in terms of, you work with what you've got on the day, people's energy levels, their ability to concentrate, etc. But the things that you mentioned before, like clients who are super sensitive in their hand joints, especially thumbs, well, I'll just, work with intolerable pain. So, if they can tolerate it, great, just keep punching through. And if they can't, well, figure out an alternative movement that's going to work, similar muscle groups or a similar range of motion. Instead of gripping with like a power grip where you grip, with the thumb wrapping over the outside of your fingers, you could grip with the thumb and the fingers on the same side of the bar or the strap handle, which might, alleviate pressure on the thumb, or just play around with different grips in order to find, what is least uncomfortable. I would make an effort not to dwell on it and only sort of find modifications, for the exercises that are particularly intolerable for the client, and don't make a big deal about it. But if it's, it's a big deal for them, then those are the modifications I'd suggest. Hope that helps.